wow moment is when one individual intercedes in the life of another person and fundamentally changes the trajectory of that person's life. It could be a coach, it could be a parent, it could be a friend, and it quite often is a therapist. We talk about wow moments in the context that our customers are behavioral health providers across the country, meeting with folks on a daily basis, trying to help them become who they are meant to be and their best version. We want to remove any obstacles that get in the way of a behavioral health provider impacting the life of another person. We did a survey and found that the typical clinician spends 40% of their time, or 2 days a week, on documentation. And it's the #1 cause of burnout and frustration.
Documentation, if it's slow on the front end, will ripple through to QA and to billing, and it makes visibility very hard at the executive level. We want to give providers back 1 day per week.
Our goal is we want to create 1 extra day a week for every role in a behavioral health organization. If we did that, we would create 20% capacity in one of the most important healthcare categories in America.
Most modernization strategies happen where companies will build a brand new application and then try to force everyone over to the new application. And these are applications that people have been using for 10 to 15 years or more. And then flipping them over overnight is just doomed for failure.
When you take the combination of a thoughtful technology modernization approach that is putting out significant new enhancements to the user base every few months and training them on it, and then giving them the option to kind of get used to that new feature at their own speed while still having access to the classic way of doing it, and then you overlay the persona-based approach, that's a winning formula for a software company, and that's our winning formula. The users at our agencies, they are so busy every 2 weeks to get a major feature release, it's just too much for them to absorb. So what we've done is we've condensed them into seasonal releases, and that gives us time to adequately train the super users in advance. It's not enough just to release it. Success for us is that users are using it, and we want to drive very quick adoption, so every few months they feel that the value that they're getting in our relationship is increasing.
So messaging is a replacement or reimagination of what we had today called CTML. Messaging to provide a better real-time communication while in the office. So staff-to-staff messaging, but doing it in a HIPAA-compliant way. We've created this amazing product insights for your business intelligence and reporting needs in a visualized way. Now it's within CT1, you can get to it immediately from your workflows, and we just streamline that experience to get access to that data. Client performance tracking is a new feature we introduced on our mobile app to quickly track the performance and document for multiple clients at one time.
We really want to create this unique, guided experience. At the end of the day, my Google Maps doesn't tell me where I should go. I decide where I want to go and what I want to do and the impact I want to make, but it helps me get there quicker. And that's really the role of the Remarkable Health CT1 platform. We're providing the picks and acts and the software tools to these providers that are really creating these wow moments in individuals' lives, and then those individuals go out and they get jobs, they get married, they have kids, they do things that they otherwise weren't able to do, and that's super rewarding. We're just lucky.